Okay. So, hello, my name is Abirami Krishnan, and I will be diagnosing you today. Dr. Mohammed, may I ask the patient a few questions?
Please, you can go ahead.
Okay, thank you.
You're
What
welcome.
is the patient's name?
So, wannan sunanta Abirami tana so ta san sunanki. So her name is Habiba Muhammad.
Okay, thank you.
Yeah, yeah.
Um, can the patient tell me about their life, their family life, their work life, where they live?
Okay, tana so ta san kaman yaranki nawa, kaman ko kina aiki, ko kuma mai aiki mai gidanki. Eh, okay, okay. Sai yaranki nawa. Okay, kina wani sana'a ne? All right. She says she's 55 years old. She has 7 children. She is married. She is not gainfully employed, and she's married. And her husband is retired civil servant.
Okay, thank you.
Yeah.
Why is the patient here today?
So me yake damun ki? Me yasa kika zo asibiti? All right. She said she has fever, headache, and general body weakness.
Okay, thank you.
Yeah.
May I ask her about her fever?
Okay. Please go ahead.
Okay. So is her fever, is it coming and going, or is it kind of constant and increasing over time?
Okay. Tana so ki ɗan yi mata bayani akan zazzabin nan. Tunda ya zo yana ƙaruwa ne ko yana raguwa? All right. So the fever does not increase, but is intermittent.
Okay, it's an
Comes and go.
intermittent
Yeah.
fever.
Yeah.
Can you please check her temperature for me?
Yes. Her temperature checked is 37.9 degrees Celsius.
Okay, so that is a slight fever. And
Yeah.
is her headache, is it no, is it centralized in one area, or is it her whole head that hurts?
So ciwon kanki nan ta ina ne kai din? Duka kai din ne ko kuma waje guda ne? All right. She said the headache is on the forehead. That's frontal headache.
Okay.
All right.
And has she had a loss of appetite where she doesn't feel like eating and any like dizziness?
Kina jin kaman jiri ne? Okay. Kina jin bakin ki kaman daci ba ki son cin abinci? All right. So she said she has some loss of appetite, but no dizziness.
Okay.
Yeah.
So, has she also kind of had any nausea, any vomiting?
Okay. Kin yi amai ne ko kina ji kaman zaki yi amai? All right. She said she once this morning. Okay. She said she had nausea, but she has not had any vomiting.
Okay. So, I'm
Yeah.
going to be diagnosing this patient with malaria. And
Okay.
in order to test for malaria, I will do a rapid diagnostic test.
Okay. That's correct. Rapid diagnostic for this patient revealed 2 pluses of malaria.
Okay, so two
Yeah.
pluses of malaria is mild to moderate. And
Yes.
sometimes with malaria, there's also anemia, which could become a
Okay.
complicated case. So we're
Okay.
going to go check for anemia as well with a blood
All right.
count.
All right. So for the blood count, the hemoglobin level for this patient is 13 grams per deciliter.
Okay, so
Yeah.
because she does have a normal amount of hemoglobin in her blood, that does mean that she does not have anemia. So I
Okay.
will be finalizing her diagnosis with a uncomplicated case of malaria.
Okay.
And in order to treat this uncomplicated case of malaria, I would suggest using an ACT.
Okay.
And in order to prevent this malaria from happening in the future, I would suggest trying to avoid mosquito bites whenever possible. And usually we can do this by wearing long sleeve clothing and long sleeved trousers and shirts, and also using mosquito nets when we're sleeping. That way the mosquitoes will not bite when you are sleeping. And also, if possible, using a mosquito repellent ointment.
All right, that's very good of you, Abirami. You have done well. From the history, you're able to know that this patient is having malaria, and you've done well to try to rule out possibility of this patient having anemia, even though she doesn't have. It's very good of you. and you did the right testing method, RDT, which revealed confirms that this patient is having malaria. You also suggested the correct treatment. SCT, which is correct for this patient. Uncomplicated malaria is oral, which is correct, as you said. And you also suggested means of future prevention, wearing of long pants and long sleeve shirts, and sleeping under mosquito treatment. So, in all, you have done very well, Abirami. Congratulations.
Thank you, and I thank you so much for meeting me today. And I hope all my treatment plans help you feel better soon.
All right, to tana gaishe ki, Habiba. She said she's also grateful and she's also happy to participate. She's grateful for what people have done to her.
Thank you.
So, congrats, Abrami.
Thank you, Dr. Mohammed.
Yes.
Perfect.